It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Beautiful people, thank you for joining me with another episode of Spill With Me, Jenny D. This episode today is brought to you by Clair Health, a local health system that was recently named one of America's 100 best hospitals for prostate surgery by Health Grades. With me today to discuss men's health and prostate cancer from Clair Health is Dr. Shailen.
Hey guys, how y'all doing?
Dr. Shailen Sehgal is here today because we need to talk about men's health. I mean, I feel like it's one of those things. But we're going to talk about prostate cancer, and you specialize in urology and your practices with St. Clair Medical Group. So I'm so thrilled to have you today. Thank you so much.
Thanks. Yeah, it's my pleasure. My pleasure.
Yeah. Oh my gosh, this is something that I feel like we're doing No Shave November.
Yeah. I shaved. Sorry, I shaved.
How dare you? But, do you know what that, like, a lot of people talk about that no shave. A lot of people don't know what that means.
Yeah, I think it's just bringing a consciousness to men's health and the fact that this is 1 month where we can talk about it. And so if somebody's not shaving and you've seen them shave the whole year, you say, why didn't you shave? And then you have a conversation about it.
Right.
And you can talk about, why men's health is important, what aspects of it are important. What does men's health mean? All those sorts of things.
Right. And I love that. I love that men do that. And I do see it a lot more than, usual. So I'm so glad that we're tackling this for this episode. So how important is it for men to get regular health checkups, even if they're not feeling like they're feeling good? How important is that?
Yeah, I think it's really important. I mean, I think that part of it's the culture of being a man. Right? Like most men don't go to the doctor unless their woman tells them to go to the doctor. Right. So there could be something that's brewing that they don't know about. And that's one major reason to get checked out. I mean, as a urologist and urologic surgeon, I mean, we deal with prostate cancer all the time. And one of the common questions that we get is, what are the symptoms of prostate cancer?
Yes.
And the answer is typically there's no symptoms. And so that proves the point that it's important to get screened. Because if you don't know about it, it can kill you, right? So what you don't know about can hurt you. So in regard to prostate cancer, it's super important to get checked out because there's no symptoms associated with it.
Right.
And things like testicular cancer, which actually guys don't always know, peaks really in men age 16 to 34. So it's a young man's disease.
What?
I did not know it's something that is extremely curable. I mean, the cure rates for testicular cancer are over 98, 99%, but you have to know about it. And, usually that just involves a simple exam that you do in the shower. But number one, guys don't necessarily know how to do the exam, and they don't know to do the exam. And with a regular health screening with either a urologist or their primary care doctor, it can be explained to them the way to do that and the rationale for it, and it saves lives. So testicular cancer, prostate cancer, things like bladder cancer, there's no regular screening that we do for bladder cancer, but typically oftentimes when you go to your primary care doctor's office or urologist's office, they're going to check your urine, right? And if they find blood in the urine, then that's a sign of bladder cancer. At least it triggers a workup for that blood in the urine. So again, something silent, right? It might not be blood that you see, but it's on the microscopic specimen.
Oh my goodness.
And so
that's scary.
Yeah, right.
So you see blood in your urine, that's like a red flag. Like, you better get checked.
Absolutely. Yeah. If you see blood in the urine, that's not normal, right? And you should always get checked. But there's a big group of guys and women, but guys that have microscopic blood in the urine, and they never would have known about it unless they showed up at their healthcare provider. Right. So that's another silent thing. And those are cancers. Those are the big ones, right? Things like low testosterone, you might feel a little bit run down, and you don't know, why you don't feel the same as you used to. And just with some good questions from a primary care doctor or urologist, say, how you feeling? How's your libido? How are the erections? How's your energy?
Right.
And with a few screening tests, then you say, you know what, we should check your testosterone. If you didn't show up at that primary care doctor's office, you never would have gotten the screening questions, and you may never have gotten your testosterone checked. Okay. Um, One of the other interesting things I think about erectile dysfunction too is that guys think about erectile dysfunction like it's the disease process itself, or it's the problem itself,
Right.
but it's actually it can be a real harbinger of other things going on in your body, and we'll talk about this more later. But erectile dysfunction is it's essentially a blood flow problem. So if you have a blood flow problem to the penis and with getting erections, then you may have a blood flow problem with other parts of your body, right?
Oh,
With blood
yeah.
flow to your heart, to other vital organs, etc. So it suggests that your cardiovascular health is not where it should be, right? So sometimes I remember guys that we've seen with erectile dysfunction, and then we say, well, you might want to really get checked out with a cardiologist to see if you have a problem with your vasculature, and
Right,
oftentimes
they're
they do.
trying to diagnose themselves sometimes.
Yeah,
They're like, well, I'm not going to go to the doctors because you really don't want to talk about it because there's a lot of things that, you know, I'm saying this in general because there are women out there too that don't like to talk about their health. Well, maybe they're embarrassed, maybe they don't want to go to the doctors. It's just that's the stigma that we're trying to erase because there, like you said, there's underlying other diagnoses that could be
yeah,
doing,
absolutely,
having this,
absolutely.
I mean, do you think like how do you like lifestyle factors like diet, exercise, stress management, did that impact men's health as they age?
Yeah, absolutely. I think the two biggest categories for the way men's health age, and it shows it at least in the urology space, is number one, their testosterone levels. So we know that as you get older, your testosterone drops. That's just a fact of life. But you can combat that drop in testosterone with a few ways. There's a direct correlation between exercise and increasing your testosterone levels. So
When you
that's
say exercise, I'm sorry to interrupt you,
yeah, yeah.
do you mean like more of like cardio or lifting weights or both?
Yeah, both.
Okay,
Absolutely both.
both.
Yeah. And
Okay.
one of the reasons why is because that's a great question, because what happens if you have excess fat in the body is fat in the body will hold an enzyme called aromatase. All right. That is an enzyme that converts testosterone to estrogen, which is the opposite of what you want. As you get older, you want to preserve all the testosterone you can, right? So if you have testosterone that's converted to estrogen, you're losing out on that testosterone. And obviously, as we get older, we put on more weight,
Yes.
and as you put on more weight, you get more of that enzyme aromatase, more of that enzyme, less testosterone. So that's one thing that changes as you get older, and you can combat that with a healthy diet. Also, this is something that guys don't realize. Testosterone is not unlike other proteins in your body or other chemicals in your body, in that it's formed when you sleep. So
Really?
for a healthy lifestyle, you got to sleep. So staying up late and waking up early. You think that work might be the thing that's your salvation, but it isn't. Because you
It's the
have to get proper
stress.
sleep, and
Right.
especially as you get older and your testosterone levels drop, you can combat that with getting proper sleep.
I know with my husband, he just lifts weights. He started to do a little bit more cardio. He
Yeah,
doesn't even drink enough water. I always yell at him about the water, and he doesn't sleep
yeah,
because he's always like my mind's racing.
yeah,
So I that's so hard because you want to you got to your diet. You got to exercise. You got to get sleep, and it's like when you age, and I know for women, we're going through menopause. It's really hard for us to sleep, but
yeah,
you need that sleep.
yeah, yeah.
Do you suggest to take like anything to help, like a sleep aid to help you sleep?
Yeah, I mean, I would talk like that's primary care doctors are probably better at managing that than not. I mean, certainly stress reduction techniques are a good
Right.
strategy for improving all these things. I mean, stress in and of itself will build up cortisol in your body, which is a stress hormone, for lack of a better way of describing it, formed by your adrenal glands, and that will actually decrease testosterone and make you less likely to get erections too. So, I mean, you talk about stress in a direct correlation to testosterone, and also causing erectile dysfunction, but it also messes up your sleep, and so it's all
It's
interrelated.
like a spiral. Like you're
Yeah,
going down. If one thing's not working, the other thing's not working. And I think that's a lot of there are probably a lot of men out there that don't realize that it's all kind of correlation to each
Absolutely.
other. Now, this is one thing that you should be telling me, because what message would you give to women listening who want to help improve the health of a man in their life, particularly when it comes to preventing and detecting prostate cancer? Like, how do I get my husband, my sons to go to the doctor and
Yeah.
get this checked? Because
Yeah.
I think that they think if they're not getting symptoms, or, they're not doing their yearly regular checkup, it's how do you get them
Yeah.
there?
Yeah. So I would tell them two things. I would say exactly what you said, what we talked about earlier, is that you're not going to have any symptoms from it, right? So guys will react instead of act, right? So they'll react when they have a symptom. They'll say, "Well, I'm peeing great. I feel pretty good.
Right.
I can't have prostate cancer," but it's completely silent. I mean, I would say over 90% of the guys that I diagnosed with prostate cancer have no symptoms.
Oh my
So that's one reason
gosh.
that's one kind of ammunition you can tell them,
Whew.
is that you're not going to have any symptoms from this, so you should get checked out. Number one. Number two, I think the most important thing, and this is sometimes the biggest tragedy for us, is that prostate cancer can almost always get fixed if we find it, right?
Right.
So it is one of the most curable, treatable diseases out there, especially
Well, that's good to hear.
especially as cancers go, but only if you show up for it, right? So I think that for the women in these guys' lives, I would use those two pieces of information to get them to go to the doctor. Is that number one, you're not going to have symptoms from it, so you can't say, "Well, I'm just going to wait till I feel something coming on. Or if I feel funny, then I'll get checked out." And number two, so it's a rectal exam and PSA. I'm sorry, what I was going to say is that it's very treatable if we find it. That's what I meant to say.
Right. Okay.
But yeah, the two tests are the PSA and the rectal exam.
Okay.
So the PSA is a
Yeah, I was
blood
gonna
test.
say, what does that
Yeah, yeah. Let me explain. The PSA is a blood test that it's just a regular blood draw that you can get. You don't have to fast for it, and it tests a protein that's secreted by the prostate. Now, the PSA test, if it's high, it does not mean that you have prostate cancer, but it means that you could have prostate cancer. And so your PSA can go up for a variety of reasons. It can go up because of the size of the prostate, inflammation of the prostate. Even if you ejaculate, the PSA can go up, or prostate cancer. So what we usually tell guys is that if you have a high PSA, we need to further investigate it and strongly consider doing a biopsy of the prostate. And then the rectal exam. So the PSA is not perfect. It's the most commonly used screening test that we have in the United States to look for prostate cancer.
Oh, wow. Okay.
But it can certainly miss prostate cancers. I was actually just seeing patients. I always tell them, these stories of patients that one of the first guys that I saw many years ago that I diagnosed with prostate cancer had a PSA less than the number one, and I felt a nodule on rectal exam. It turned out he had pretty significant prostate cancer.
Oh my gosh.
So nobody wants to get a rectal exam, right?
Right.
But the idea behind it is that a PSA is only half the story, and so getting the PSA checked is great, and a rectal exam is absolutely a nuisance. But there are plenty of cases of guys that have an abnormal rectal exam and a normal PSA, and they have prostate cancer. So the two need to be done together to try to figure out whether somebody rationally has prostate cancer.
Yeah, that seems like but you have to go to get checked. I mean, you're not going to know. We talked about like a little bit of like at what age, should men start being screened for prostate cancer? I mean, like you said, you said 16?
No, that's for testicular cancer.
Okay, that's
testicular cancer. They should do self exams. We always advocate for that. So for prostate cancer, and so it's not always good to be Dr. Google, but in some regards, if you look up the guidelines, if guys are really curious, they want to delve into this. I mean, we practice in as much as we can by the American Urological Association guidelines. And what they say is, and you can Google AUA guidelines and you can read them yourself, and it gives credibility to whatever your healthcare providers are telling you. But the idea behind it is this: if you're 40 and you have risk factors for prostate cancer, what are those risk factors? So specifically African American race or a family history of prostate cancer, then you should consider getting screened. Now, nobody says you have to get screened. This is a joint decision-making process you have with your healthcare providers.
Right.
We would certainly recommend it, but that's when you should really consider getting screened. So age 40, family history, or African American race. 45 to 50, forget about those independent risk factors. That's when is kind of the prime time to start getting screened for prostate cancer in anybody. All
Oh
right.
my.
And again, these, like we talked about, Jenny, that's PSA check, the blood test, and rectal exam.
Right.
And then that's when it begins. And then we typically do prostate cancer screening up until age 70. Certainly we have patients beyond the age 70 that we continue to do prostate cancer screening on, but that's what the guidelines say until age 70. So that's the prime time. 45 to 70 is when we do PSA and rectal exams.
Okay.
Yeah. Mm-hmm.
Now, when we were talking about the current survival rate, with prostate cancer, I mean, it's improved over the years, hasn't it?
Yeah, absolutely. Absolutely.
How does early detection play a role in those statistics?
Well, I mean, if you look at, so first of all, I think that surgery and radiation have gotten better over time, and that's improved things. There's also targeted therapies. So for disease that's not in the prostate, that's outside the level of the prostate, we have to, we work in conjunction with our medical oncology colleagues, and they can give targeted therapies to treat metastatic or prostate cancer that's not just in the prostate. So all those factors have worked to improve the survival rate of prostate cancer over time. But really what changed things was the PSA test, which became much more common in the 80s and 90s. Instead of guys having symptoms, and when somebody has symptoms for prostate cancer, usually it's too far gone at that point.
Right.
And guys would show up a long time ago and they say, "Doc, I can't pee." And then you do a rectal exam and you feel prostate cancer. Instead, the PSA test would pick up a lot of prostate cancers they never did before. So certainly the PSAs played a role in early detection for prostate cancer, and just getting the word out about, the rationale for the fact that it's very curable. I think all these things have made it so that prostate cancer has a very high survival rate. I mean, we're talking about, this day and age, for all comers for prostate cancer, I think the survival rate, overall 5-year survival rate, is 97 to 99%.
Oh, wow.
Localized, it's almost 100%. And even if it's spread elsewhere, I mean, this isn't a great number, but 32%. I mean, that's still a significant number of guys that are surviving past the 5-year mark. But the key is to try to identify the ones that are localized, because we want to get close to 100% as we can.
Have you seen a lot of young men with prostate
Yeah.
cancer?
Mm-hmm. Yeah, we do.
That's what I feel like, when we were talking, St. Clair Health, we were talking about breast cancer. We are seeing a lot of younger women getting it.
Yes.
And that's what scares me, even with prostate cancer. We were talking about the environment, or what is happening with people getting cancer so young.
Yeah, I think it's a detection. It's sort of properly detecting it. I think that there's been a lot more dissemination of the information that if you have a family history of prostate cancer, you have a high chance of developing prostate cancer at some point in your life. And when that information is told to somebody in their 40s, then they're more likely to get screened for it. So I don't know if they're necessarily getting prostate cancer earlier in general, or just finding it earlier because guys are better educated about getting screened.
Can you have it for years and not even know you have
Absolutely.
it? Oh, wow.
Absolutely.
Okay, so I didn't even think about that.
Yeah.
That's the thing. Like, when I was reading this, I didn't even know this. St. Clair Health was recently named one of the 100 or America's 100 best hospitals for prostate surgery by Health Grades. What is it that sets St. Clair prostate cancer care apart from everybody else?
Yeah, I mean, we've had advanced robotics for a while. We have a number of surgeons that have done hundreds of robotic prostatectomies. So I think that is a big deal. I mean, with doing the surgery over and over again, you're more experienced with it. But I think that we also have a really good relationship with a medical oncologist and radiation oncologist. Like, I think all of us have each other's cell phones, right? So we have a question about a patient, we just pick up the phone and talk to them, which is a nice thing in a place like this, because the community feel carries over into our interactions with the other doctors. So I think that makes a difference. I think the fact that we have, 5 urologists that feel very comfortable with one another, and we can tackle difficult cases, because whether it's in the operating room or outside the operating room, feel very comfortable talking to each other about, what do you think about this? How would you approach this, et cetera. So instead of referring those patients out, a lot of times we can deal with it right here. So I think that sets us apart too.
That's amazing, though. 100. I mean,
that's great.
That's incredible, America.
Yeah. We're proud of it, and I think that also we try to be really good about being patient advocates.
Right.
Meaning that when somebody walks through our door, it's really our interest that they get whatever they want. Right. We have no, quote, skin in the game. All 5 of us are extremely busy. We do as much surgery as we can, but if somebody wants to do radiation, we want to be the biggest cheerleader for them. we want them to get all the opinions that they need to get to make an informed decision. So I think, with all 5 of us, the idea is that we want to be a patient advocate. I think that's different.
I love that. And,
Mm-hmm.
and then people feel comfortable coming here. But do you suggest they go to their primary care first?
Yeah, I think so. I think it's, frankly, sometimes it's hard to get in to see a urologist just for general screening. Um, uh, Absolutely, if you want to, that's a great thing to do. But the primary care doctor is a nice place to start because they are more than capable of doing this. And they can also sort of look at all the things that we initially talked about, right? The low T, erectile dysfunction, testicular cancer screening, talk about checking your urinalysis, et cetera. So it's kind of, and they can talk about your other healthcare issues, colon cancer screening, et cetera. So I think it's a good place to start for everything. And then certainly if they detect something abnormal, then, they usually see a urologist then.
Right. So the blood, so getting blood work is when you're going to see the levels. And
Okay. Yep. Mm-hmm.
I mean, I think we already covered this, but knowing that prostate cancer is highly treatable, especially when caught early, your team supports patients not only through treatment, but they also long-term survivorship journey.
Yeah. One of the things that, it's a testament to Clair Health, how organized they are with stuff, but essentially, there's a cancer care coordinator that gives a list of patients with the diagnosis of prostate cancer to our office. And then our nurse coordinator will generate a form and create a packet for each one of those patients and send it to them. And that packet tells the patient their Gleason score, which is their pathology score for what kind of prostate cancer they have, their PSA.
Oh, there's different kinds of prostate cancer?
So there is one pathology, meaning that one type of prostate cancer that we see under the microscope. In general, there are some other rare forms of it, but by and large, there's one kind, adenocarcinoma. Within adenocarcinoma, there's different grades of it. So we'll say a score 6, 7, 8, 9, or 10 are the most common ones.
Okay.
And 6 is the lowest risk and 10 is the highest risk. So when I say different kinds, I'm just conveying, I guess, the least aggressive and most aggressive pathologies.
Right.
But anyway, the nurse coordinator will get that information. When they have that information, they'll create the packet and they'll send that packet to the patient. So the patient has a summary of their PSA, their pathology, their treatment, and then the fact that they need to continue to follow up. Because one of the things, are guys that, some cancers you get taken care of and it's a one and done, right? Prostate cancer is one of these things you have to continue to get your PSA checked after the prostatectomy or after treatment, because the PSA test is a decent test to screen you for prostate cancer, but it's excellent at detecting a recurrence of prostate cancer. So it's important to continue to get that checked.
Men get it back?
Yeah, so yes, absolutely. So, you check the PSA every 3 months for the first year afterwards, every 6 months thereafter, and then we space it out to yearly and a couple years after the initial screening period. But yeah, it's important to continue to get checked, and guys forget that. So the packet conveys to them the importance of continued follow-up. Also, there's a lot of side effects that guys don't know whether they're normal or not. The packet describes certain things that are normal and not normal, especially in regard to their urinary issues after prostate cancer surgery. So I think that's one of the strengths of our practice, is that we have a coordination with a cancer care team, to create a depot of information for each patient.
Right. And, it's awareness. And it's not like guys are sitting around talking about prostate cancer.
No. Some do. It's actually encouraging.
If you have a scare, and you do have it, or you did have it, and you're recovering from it, that's when the guys are, hey, listen, I just, I went through this, you better get checked.
Yeah.
That's why the conversation needs to be going every time.
As much as it's destigmatized, more guys are going to talk about it when they're having beers on a Friday night. I have plenty of patients, that see me because their friend was diagnosed and they want to get checked out, and they clearly had a frank conversation whenever about what they went through. So I think that it does happen, but it happens less with men than women.
I know, right? It's
right.
So, Dr. Sehgal, is there anything else you would like to tell the listeners and the viewers about men's health, about prostate cancer?
No, I think that I think
we covered everything.
Yeah, I think we did. I think you did a great job. But I think the most important thing is that we can fix it, but we can only fix it if we know about it, right? And so don't worry about coming to the doctor, because they're not going to necessarily tell you to do anything. They're just going to try to make sure that nothing's wrong. That's the message I would tell people.
Yes, and it's the stigma of I'm fine, there's nothing wrong with me. No, it's just get checked, get that blood work. And so you also said, so we're recommending at like 40 years old, especially if you're African American or if you have a family history of it, but around 45.
Yeah, 45 all comers.
Definitely.
And one of the things I would say about that number 40 is that African American race, obviously you know about that. But a lot of guys don't know their family history. So sometimes, Thanksgiving's coming up, and
we're going to be talking about that.
Sometimes you just need to have a conversation with your family,
yeah.
Uncles, cousins,
right,
dads, grandfathers, any history of prostate cancer, right? Because you probably know about your father, but you may not know about your grandfather. Exactly. You may not know about your uncle. And when I say a family history component, it's not just your dad. So it's important to realize that. We're talking about 40-year-olds. Not just with their father having a history of prostate cancer, any familial history of prostate cancer.
Talking about men's health, family history, we're actually going to be doing an episode on that because we were talking about how family history, we are not talking about it now that we're coming together at the holidays. Why aren't we talking about it? Because I do actually find myself going to the doctors and not knowing, like, hey, did anybody have, I have to call my mom still to this age because I don't retain it or I don't remember.
Yeah.
Or there's things on there that are like, what is that?
So, well, there's some stuff that they know and they're not going to tell you because nobody likes to talk about their personal health history. But if it's about your health, your daughter's health, of course you'll talk about it. But you won't necessarily volunteer it. But if you're asked about it, then you will.
Yeah, the things you learn about your family is like, wait a minute.
Yeah.
I didn't know all this.
After a couple of drinks at Thanksgiving, right? Yeah.
I know. So, to learn more about urologic specialists like Dr. Sehgal, urology services offered at Clair Health, visit stclair.org/urology or call 412-942-4100. So thank you so much for taking the time.
Yeah, it's my pleasure. My pleasure. Yeah.
I'll tell you what, I learned a lot.
Good.
Now I feel like I have to be an advocate. I have to be out there saying, hey, did you get checked for prostate cancer?
Go for it. Yeah, with your finger out. Yeah, right.
Sehgal told me.
Yeah, right.
They'll be calling.
You got to be careful. If you hold your finger out, I think you're going to do a rectal exam on them. So.
I know.
The urologist.
Yeah, I don't want to scare anybody.
Yeah, right.
That'll be my next thing.
Yeah, right.
It's podcaster /
Right.
Thank you so much.
It's my pleasure.
I really enjoyed this, and I feel like that this is a great opportunity for people to be aware and to know exactly what they're looking for, and that is no signs. So thank you so much for being on
you're welcome.
with me, Jenny D.
Yeah, thanks a lot, Jenny.
Thank you. Take care.
Come spill with me. Come spill with me.